Hi, I'm Jamie Lee. I'm the executive editor at MM+M. I'm here today with Kristin Cahill, president of North America for GCI Health. Thank you so much for being here.
Thank you for having me.
So what are 3 trends you expect to see in healthcare communications in 2017?
One big thing is going to be companies really figuring out patient centricity and what that means for them. A lot of companies are talking about it right now, but it's almost become like innovation in the sense that people say it so often it starts to lose its meaning. And so I think what you're going to see is a lot of companies figuring out how to differentiate their commitment to patients. At GCI, we actually have an initiative called Patients at the Center, which is all about helping our clients to really put patients at the center of their business, in their communications, but doing it in a really authentic way. And so I think in 2017, we're going to see a lot of companies really try to figure out how to be more transparent in their patient communications using social and a number of other channels. I also think that we're really excited about scientific innovation in 2017. We see, even among our clients, many of them are poised to introduce really breakthrough technologies, really revolutionary treatments. But related to that is, what is the FDA going to do? And I think a lot of people have their eyes on that in 2017. There's a lot of legislation in Congress right now that could impact scientific innovation. So I think people really are kind of just waiting and seeing what's going to happen, and that's going to impact that space a lot. The other thing we've talked a lot about at GCI is kind of this convergence of corporate and product communications, and the fact that really our clients are realizing that you have to speak with a single voice when it comes to those two areas. And so I think what we'll continue to see is companies trying to figure out how they can align things like the Sustainable Development Goals to their commercial activities, or figuring out how they can really infuse their corporate culture or their corporate mission into the way they talk about their science, and really kind of trying to speak with one voice and break down those silos between corporate and product.
What do you think has changed over the last year that's kind of created room for these trends to emerge?
I mean, certainly the new administration in Washington has a lot of people, as always, kind of looking at how is that going to impact healthcare. Certainly the inundation of content that we all experience every day continues, and that I think is forcing companies to be more and more creative about how they find white space and really differentiate themselves. Another thing that we're hearing, though, which is interesting, especially given all the collaboration that's happening in healthcare right now, is we hear from physicians constantly that they are more and more restricted in terms of how they can partner with industry when it comes to communications initiatives. And I think a lot of that is driven by the Sunshine Act, by this kind of desire to have more transparency and independence. But I think what that's doing to healthcare companies is really forcing them to find other stakeholders to tell their story, whether it be patients or industry partners or even their own executives. And that's something that is impacting kind of the way we work as well.
And what are 3 trends that you think we will see less of in 2017?
So I think definitely, coming out of this election, there's a lot of attention on biased media, fake news. There's a lot of that swirling around. And I do think what we saw in 2016 was the emergence of news outlets that very much want to position themselves as unbiased. And so I think we're going to continue to see that, especially as it relates to healthcare, where I think, people agree that it can be covered from so many different angles. I think from a social media perspective, we're probably going to start to see less unbranded communities and probably more branded communities. I think that's being driven by the fact that healthcare companies are becoming increasingly comfortable with having branded social communities. I think the marketing clients that we work with really feel the pressure to show ROI and show connection between social media and sales, and branded is certainly a better way to do that. And also some of the platforms, whether it be Facebook allowing rolling ISI and ads, those types of things, and kind of the loosening of those restrictions, I think is going to allow people to do more and more branded. And then I would say the other thing in the social realm is people becoming more and more comfortable with the idea of paid promotion. So, even in healthcare, people are still very reliant on kind of organic distribution of content, and really that's not, you have to have a robust paid promotional strategy in order to be successful. So I think we're going to see less reliance on that kind of organic distribution, and people really recognizing that you have to have a sophisticated promotional strategy behind your social content.
And, in 2016, we saw companies like Apple and IBM move even further into the healthcare space. Do you expect this trend to continue?
I think it will absolutely continue. I hope it will. will. I think that those collaborations bring a lot of great things to the healthcare space, certainly access to big data, to big insights, to innovation. I think it's also been interesting to see how those companies have influenced healthcare organizations in terms of their startup mentality, the way that they work, their kind of willingness to fail and try again, their willingness to take thoughtful risk. So that's been really interesting to see. But I think that there's a lot of partnerships in the healthcare space that are going to continue even beyond kind of the convergence of technology and healthcare. Certainly we're seeing all these government-led initiatives like Cancer Moonshot and Precision Medicine Initiative that are really about the public and the private sector coming together to solve problems. You see unprecedented collaboration between pharma and academia when it comes to driving new research. And I think even in the public health sector, we're seeing that people really realize that you have to take a holistic approach to addressing challenges, ones that not only tackle health challenges, but also look at socioeconomic factors and behavioral barriers and political issues. And so that collaboration, I think, is going to continue across the industry. And I think what's interesting for us as communicators is that that creates a lot of really interesting opportunities to differentiate our clients and to talk about them in a different way, but it also creates challenges. You know, we need to really help them to navigate those partnerships. Everyone kind of has their own perspective and interest on how they want to be portrayed. And it's really, I think, up to us to help them to just keep the science and the patients at the center of what they're trying to talk about so that they can tell a really cohesive story.
Great. Well, I think that should be it. Thank you so much for coming in today.
Thank you for having me. This was great.